Linda, good to have you with us. Let's reflect back on what Health Minister Zweli Mkhize had to say, particularly starting with, traveling and trading abroad. Numerous business and people and entrepreneurs are quite concerned, especially those doing business in China, if they'll be able to travel or even still do business there.
Well, Tumelo, before we get to the concerns of some of those business people, the ordinary South Africans that are obviously looking to be traveling towards China for different reasons, really, we do need to reiterate the fact that the minister did say that South African can breathe a sigh of relief because no one in the country and no one who is a South African, internationally so, has been reported to be affected by this virus. So at this stage, there is that sigh of relief. But again, the concern is coming from all of those who might have businesses that require traveling, as well as those who are working abroad, particularly the 3,000 students that are in China at the moment. What the minister has said, Dr. Zweli Mkhize, the Minister of Health, is that at this stage they have no reason whatsoever to stop the trading as well as the traveling from South Africa into China and back from China to South Africa. And he says this is because they haven't had any incident or they haven't had any case reported in the country, and that means that their ports of entry in terms of their checking, whether they, in terms of their checking, trying to detect whether the coronavirus has arrived in South Africa, they are saying they are well satisfied with that. And as per the recommendations of the World Health Organization, they will stick to that. They will try and keep monitoring some of these ports of entries, including the one that I am next to, which is the OR Tambo International Airport. But what they are saying is that at this stage, they will continue with the monitoring, but not halt some of those flights that are going out. And if we can just take a listen to some of the sentiments shared around that particular checking of some of these ports of entries from Dr. Zweli Mkhize earlier on.
Port health services also are provided in South African ports of entry with staff complement of about 300. Apart from digital thermal screeners, port health officials have also been provided with additional handheld thermometers to detect the temperature of any traveler arriving into the country. We have also requested the support of the South African Military Health Services to work with us so that we can actually reinforce manpower in the various ports of entry where we believe that we need additional support. And so that is actually going to be mobilized as early as today. Screening is conducted in the ports of entry to early detect an ill traveler through one temperature screening that is conducted in 36 points of entry utilizing non-invasive thermometers, where all travelers arriving through the ports of entry are channeled to the temperature screening. If a traveler is found to have an elevated temperature, they are assessed by a nurse, and if determined to be suspect the case, then they will be safely transported to a health facility for further management. 2 arriving conveyances, the health officials will go on board each arriving international aircraft and ship to determine if there is any sick traveler. If a traveler falls sick whilst on board, port health officials are informed by the crew members in line with the World Health Organization and the International Civil Aviation Organization requirements, and an assessment of the traveler is conducted upon arrival. This is standard, but we want to just confirm that this has been reactivated, and therefore we are on higher alert this time around.
Well, we're hearing there, Linda Guhle, the health minister saying they're completely on high alert as a health department to ensure that they are ready and prepared should, of course, an issue or a case of coronavirus hit South Africa or even the continent. But, there have been growing concerns about whether or not the department can even handle coronavirus, not only for the country, but also being, sort of a port also for the continent where research will be based, where medical centers will be based. And what is the health minister then saying in response to this?
Well, Tumelo, you would understand that even as yesterday when the World Health Organization held that press briefing, they did say that one of the reasons they have declared this particular virus as a public health emergency of international concern was because of that very reason, to say there are countries that they fear that when this particular virus enters into such states, they will not be able to deal with it. But in fact, personally so, I asked the minister to say what is it exactly that we have been categorized under in terms of that statement. statement whether we are a country that is ill-prepared, as they said in that particular press briefing, to say, are we ill-prepared for this, or are we one of those countries that would bode well in terms of dealing with this particular virus. But what he said was that we are one of those countries that is prepared, and the screening of some of the passengers that are arriving in South Africa is just but one phase of their whole plan to contain this thing. They do say that there are some of the places that they have designated, such as Charlotte Maxeke in Gauteng, Tembisa Hospital, as well as the Steve Biko Academic Hospital. So there are some of those hospitals that have been set up to ensure that they are able to deal with this particular coronavirus. But they are saying at this stage, since there is no one who has been reported, what they are focusing on is the screening part of it. But should there be anyone, they will then be able to direct them to some of their facilities that they have set up. And we understand that training and consultation is being carried out there with some of the health practitioners in those facilities.
All right, thank you so much, Lindo Guhle, for that update. That's my colleague Lindo Guhle Kulu. Following, of course, the health minister's sentiments held at a media briefing, Health Minister Zweli Mkhize assuring the country that they are prepared for any case that may come from coronavirus. They're doing all they can through their emergency centers to ensure that, of course, they track this virus. Now, also at the entries of ports, particularly at the international airport, that is OR Tambo, they'll be conducting screenings there for those who are also traveling.